Actually got a thumbs up. All right. Live chat, pop-out chat. One more. Again, I am not seeing this. Okay, maybe here it is. So I'm going to close this one. I'm going to open up right chat. Hi guys. And gals. Top chat. Live chat. Alright, maybe this is it now. Okay, so you're good to go here. Alright, so just before we went on to the break, I asked what's one right, because so everybody's here. So I'm just gonna review the picture that Jahil sent to give you credit where credit is due, right? And Jahil said that you all were commenting, and I am seeing Kavita Ramkisune saying quarantining. Quarantining is not an access issue, Karina. So I'm sorry, Kavita. So no. Tracy is saying quarantine. So both of you, no, we're not saying that. That's not what I'm looking for. Katrina is saying surveillance and swabbing. Again, no, because there was not easy access to surveillance and swabbing. Karishma is saying offering testing not only in public hospitals but private also. Again, I would say no, because that also was not something that was easily done. That is only something recent. And even still, it's still a bit difficult to access because of there's a cost involved. There is the protocols involved. It's not an easily done thing. Maybe in other countries where they do testing on the roadside, on the highways, in tents by malls, maybe yes, I can say easy access there would have led to an improved health status, but not in our country. No KR, not travel restrictions. Jahil started to get close to it when he spoke about sanitization. Kai is saying, Kai, I remember you from my last class. Hi, Kai. Um, Social distancing, yes, to an extent, but not really, no. Um, so Kai is saying social distancing and sanitizing. Tracy is saying social distancing. KR is saying sanitizing regularly. And Marie got it right. So Marie Sundarlal, I'm going to say, well done, Marie. Because hand wash sinks are now all over. Hand wash sinks are all over by pharmacies will be the first, of course, to take the lead in wearing masks in their stores and sanitizing staff, testing for signs with respect to check. Yes, yes, Karishma, that's definitely one as well. But temperature testing wasn't widespread like 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 how. Just 1 minute, right? right? Um, we still didn't have access to that temperature testing. So sanitizing dispensers, yes, Chelsea, but even sanitizing dispensers, even that was not so easily available where you could go and get sanitizer. There were still so many people that didn't have access to sanitizer. If you all remember, alcohol and sanitizers went out of stock. But what remained in stock, and I'll make a worldwide joke here, what remained in stock in places that had was water and a sink and soap. So the winner is still Marie, who said hand wash sinks, sinks that had soap and water, or, and I mentioned it in the summer class as well, there's been evidence to prove that even without soap, using water to wash your hands for the very least gets rid of at least 75% of germs and bacteria. But soap, of course, is absolutely important to get viruses and other things out. Okay, so the winner is definitely Marie. You are on point, and I want everyone to remember that that one change of having hand wash sinks to allow everybody, no matter if you're walking on the street, you're going to bounce up a hand wash sink, and you might have touched something, and you get an opportunity. By having these things available, you now have an opportunity to sanitize your hand and to clean your hands. And your hands are the ones that direct to all orifices that can cause infection. All right, mouth, nose, air, etc. So good discussion. It might be a really nice question to put to you all for your exam. I'll think about it if I can formulate it differently. But yes, accessibility is very key and very important in public health, right? Research for new ideas and insights and innovative solutions to the problem. I am one that I am very interested in innovative solutions to problems that exist. We have innovative solutions of um, self self temperature checking, and I saw some of the banks have it. Right, you walk in and you put up your hand, you get a temperature check. It's a cheaper alternative than walking through a temperature corridor that some of the airports have. Being innovative, being innovative to your problems, and sadly, we have not seen sufficient amount of innovation and innovativeness and courage amongst our existing medical world in fighting coronavirus. We have been literally lagging when it comes to treatment options and analysis. And I know in years to come and in decades to come, the discussion will continue that our best experts were somewhat afraid to to make real decisions, to take decisive action in a timely manner that could have avoided the number of deaths that we've been having. All right. So research for new insights and innovative solutions to that problem, and it's something that I'm discussing again. That you ought to be trying to apply your knowledge and your expertise to a problem. Not all the time you can rely on evidence past to apply it to a new problem. It's a new problem. You may have to work with and tweak your knowledge and your applications to this problem. But we have seen a lot of lag in getting the right treatments or making an attempt at treatments for this coronavirus. So the public health approach: define, identify, develop, implement, monitor. I'm going to read it again. Define, define, identify, develop, implement, and monitor. We are defining the health problem. You need to define what your health problem is. Exactly what the health problem is. You need to You need to identify all of the risk factors associated with the problem. Our health problem is a respiratory illness that we have identified called coronavirus, COVID-19. What are the risk factors associated with this problem? Risk factors: crowding, close contact, open air, breathing, talking, shouting. Risk factors: comorbidities, diabetes, high blood pressure, asthma, high cholesterol, whatever else the comorbidities are. Develop and test community level interventions to control or prevent. Community level interventions: stay home if you're sick, wear your mask if you're on the outside, avoid doing unnecessary things, implement interventions to improve the health of the population, make it law, make it policy, make it an offense to contravene the act. Monitor these interventions and their effectiveness. So the Prime Minister would have spoken to the country just after the elections, gave it 28 days, and he spoke to the country again on Saturday. Monitoring these interventions and their effectiveness. Do we need to change? Do we need to alter? Do we need to adjust? Is it working? Are we getting less cases? We've closed certain activities, but are we getting less cases as we were having before? If we are getting the same amount of cases, is our intervention making sense? Is it working? These are the questions that need to be applied when using a public health approach. Okay? And you see here on slide number 17, a nice stepwise approach. Surveillance: what is the problem? Risk factors: identify what's the cause. Intervention: what works? What works? What has worked in other countries? What has worked in other environments? Can it be applied here? Is it relevant here? Implementation: how do you go about doing it and monitoring it? You see the bottom part of your slide on slide number 17, the problem towards the response, the steps taken from the problem to the actual response. You need to collect and analyze data to continuously define and outline the problem. What, where, when, who, how. Is it preventable? Is it controllable? Is it not controllable? There's some of us who are saying that coronavirus is not preventable. There's some of us who are saying coronavirus is not controllable. But it is indeed an aerosol generating or aerosol borne and a droplet transmitted type virus. And we can indeed control for those things, and we can do our best to prevent it. The public health approach requires a plan. Again, we're talking about a plan, and we've mentioned plan in our lecture yesterday. A plan is a blueprint. We need a champion, someone who is always for the cause that we are talking about. Who is your champion for coronavirus management in Trinidad and Tobago? Is it the CMO? Is it the Minister of Health? Is it your social justice warriors? Who are the champions? But the champion ideally should be the person who lives, breathes your policy. This person who is constantly aware and who is constantly making other persons aware of what we need to do, the strategy and the method, the will. And I think this is the first time I'll be introducing this term to everyone. The will, political will. Management will. And this is the desire of those in authority to actually take steps and take actions necessary for your plan to get the green light. So you always need political buy-in, or you always need management buy-in to get your plan on the road. It's very important. The funding, where is the funding going to come from? Is it from your um, local financing mechanisms, or is it from international financing mechanisms? Are you going to get a loan from the World Health Organization or the World Bank or the Caribbean Development Bank, Phar, and just do it? Just do it. Just get it done. After implementation, you need to evaluate, did your strategy work? Were your results as expected? Can this be done in other places? If none of these things are positive, then you need to abandon that strategy, revise and try it again. And you would see we go on from slide 23 all the way down. They looked at an example of drowning in Arizona. Now we don't need to use this example because we are living through a pandemic. But we'll go through this. They found there was drowning in Arizona amongst a certain age group. They used a public health approach of what, where, when, who, how. They identified swimming pools as a link between drownings of these kids. And they looked at these swimming pools, especially the drownings happen especially in the warm months. They also found that these swimming pools had no barriers around them. There was no supervision as well. We had a most unfortunate incident recently in Trinidad where some grandparents were supervising a 4-year-old, I believe it was, and she said she called all the kids inside, and one didn't come inside, and when they went outside, there is the kid in an inflatable pool, dead. You can imagine the trauma that family is going through as a result of something so simple, so tragic. Such a tragedy has occurred. So similarly in this incident, similarly in this example, the Arizona drowning example, no barriers, supervision failure. Is the problem preventable? In this case, absolutely yes. You can prevent a child from accessing a pool by putting a barrier. You can prevent a child from accessing a pool by being properly supervised. What's the priority of this? It was a high priority because these are kids, these are babies. This is your future. The goal was immeasurable. And I'm introducing to you today, your goals and objectives should be SMART. And guys from my from my summer class would know what these are. Karina, you were in my summer class. Tracy, you were in my summer class. Tell me what SMART means. Tell, for the benefit of all your colleagues here, tell me what SMART means. I hope I am getting through to you all. Can anyone say something to make sure that this chat is working? What does SMART mean? S? Very good. Oh yes, Sarah, you were in my last class. Go ahead, tell them. Specific, measurable, attainable, realistic, timely. Bravo, bravo. Yes, Kai, you were there as well. Very good. So those of you who are unfamiliar with these words, please get yourself very familiar with it. Your goals and plans and objectives must be SMART. They must be specific. They must be measurable. You must be able to measure it. Metrics. It's a buzzword in management, metrics. It must be attainable. You must be able to actually achieve it. It must be realistic. It must be something that is a real possibility that can get done, and it must be timely. Just 1 minute there, okay? All right, guys. Sorry about that. So yes, specific, measurable, attainable, realistic, and timely. There must be a time component in your goals and objectives. All right. So thank you all very much. I'm proud of my former students here who are now in this class as well. Karina, Sarah, Kai. Um, Thank you all very much for that. So we have a goal, and then there was some legislative action that was needed. You needed to put into legislation if you are having a pool in your house, it must be fenced, and there must be an individual pool safety program. So imagine that that's something that's tied in to the pool contract, that you must have a safety program done, training done. The same way in some companies they ask you to do defensive driving, it must be done, and legislative action where you must. It's in the laws that a barrier must be placed, and the results were good. The results were good. The results produced less drownings. And after having success in these public health measures, then drowning started to rise again. And what did the analysis show? And we're on page slide 49 right now. The analysis showed that there was failure to maintain these barriers. So although these barriers would have been installed 10 years ago, 15 years ago, the barriers weren't maintained, they were broken down. So if the law that was created was a sunset law, that was a law that was to take effect for 10 years, then after 10 years, people become lax. And people say, well, it's not the law to have a barrier. So they don't maintain their barrier. They start back to fail to supervise their kids again. And then you see drowning increase. So you go back to your drawing board to ensure that your laws are in place and your barriers are in place and your public health approach is done properly. All right. So that there was an example of how a public health approach was used in Arizona regarding drownings in kids. And we, of course, have our own live example of coronavirus today that can teach us so many things about a public health approach for treating with this problem that we have. So I want to invite questions from you guys. Questions or queries. This will be the end of today's class. Next week we will be We'll be doing either health ICT. We'll do 2 lectures next week because this one is a big lecture. So any questions, any queries? So Chelsea, yes, sanitizers now has become a mainstay all over. So yes, it's a definite thing that has improved our health status. And what did I mean by improving our health status? What measurable was I referring to when I said our health status increased, improved? Sorry. What measurable was I referring to when I said our health status improved as a result of this hand washing sinks? And now, yes, Chelsea, the sanitizers are now widely available. Help me link, or let us link the relationship between availability of hand wash sinks and our health status improving. Come on, guys. Come on, guys. The number of cases decreased, number of decreased infection rate. Yes. Yes, but remember we didn't have that data for coronavirus as yet. Lower morbidity and mortality rates. Guys, thank you, Sarah. Thank you, Sarah, because I was now about to say Tracy, Karishma, Sabrina, and Chelsea. You all are getting into, the complexity of coronavirus, but I was speaking to something very simple, and Sarah got it correct. There were a large reduction of cases of the common cold and fever, flu, and normal viral type symptoms. And that was as a direct result of persons washing their hands regularly after, because remember, mask wearing wasn't a law. It was encouraged. Businesses were encouraged, but it wasn't law. So we still had people out there not wearing masks and people not taking their masks seriously. So people would do so and then come into your store and get stuff and hand your money, and then you might collect it. And if you are not sanitizing as you ought to be after every transaction, and then you do this or you do that, transmission. So Sarah, you won. Sarah, right? Excellent. There were far less cases of common cold and viruses in kids, babies, in adults as well. Yes, it would have led to, you know, um, less consumption of those types of medications, but that's okay. The healthier population we have, the more productive population we have. And simple intervention of making hand wash sinks accessible to everyone, so widely available throughout the country, on the public streets, outside of businesses, significantly reduced the incidence and the prevalence of common cold and common viral type symptoms, including things like swine flu and bird flu that are still around. That are still around. Other things like viral gastroenteritis, bacterial gastroenteritis. All of these things reduced because of the germ house itself. Hands were washed regularly. Hands were sanitized regularly. And then later on, masks were worn regularly that prevented hand to mouth transmission. All right? These are some good possible questions for your exam. So glad we're discussing it. So any questions, guys? Any more questions? Any further questions? Okay, Marie, what about non-compliance? Vikash is asking about non-compliance. What do you mean, Vikash? Non-compliance regarding what? Non-compliance regarding washing your hands? Non-compliance regarding taking your medication? What non-compliance? Alicia, this is a new student. Hi. What was SMART in relation to? I missed that. SMART was in relation to your goals and objectives. Your goals and objectives should be SMART. All right. You have a goal to reduce waiting time as the simplest example. Your goal is to reduce waiting time. It must be to reduce waiting time in a month from 10 minutes to 2 minutes. All right. Karishma is asking, but isn't it difficult to differentiate between the common cold and COVID symptoms? The common cold is actually, you can differentiate it because COVID-19, sure, Alicia, and welcome. I think you're a new student to me. So, COVID-19 has been characterized with dry cough, difficulty breathing, and fever. And there was also another very significant symptom of lack of taste and smell. Okay, the common cold has similar symptoms. The common cold would usually have a, a runny nose, maybe a sore throat, maybe a stuffy nose, maybe a little chestiness, maybe a little light fever. So it's similar. It's similar, right? You can be able to screen properly for COVID-19. The issue with screen using common cold symptoms is that you may have the common cold, but you may also have COVID-19. And because of your common cold, you have droplets from your cough or from your sneeze, from your eyes that can transmit not just the common cold, but coronavirus as well. So that's why common cold and flu symptoms are screened in the context of coronavirus. All right? I hope you understand, Karishma. Let me know if you do. Vikash, for example, not wearing masks as seen as in America, would it be considered as a failure of implementation or just bad plan? It would be considered as a failure of implementation, right? And it's a failure of implementation because the plan itself initially was bad, because there was not complete buy-in, and we can use this, Vikash, to describe political will. There was no political will from the administration in the USA to make mask wearing a mandatory requirement, and because of that, there were no plans in place for that, and therefore it could not be implemented. Now we're still seeing that they're asking people to wear masks, but it's not the law. In some states are making it the law in the US, states that can do that, but it's not federal law as yet. All right, so I hope I answered your question. Karishma, did I answer your question? Just let me know. Okay, Vikash. Karishma, you gone? All right, so I'm going to assume I did answer her question, and we'll end class today right here and see you all next week. Next week, I will most likely have your in-course assessment ready with a date as well. We have 2 in-course assessments, and we most likely have I'll confirm with Dr. Maraj if we're going to do literature review as well, and get moving along towards your final exam. So see you all next week. Have a good day. Have a good week. See you then.